Hello there, welcome friend. Well, my name's Dr. Britton. I'm with West LA Neurokinesiology, and thanks for watching this video. You're probably wondering a little bit about what is spinal decompression? How can that help me with my degenerative disc disease, my nerve compression, my sciatica, or my low back pain? So today we're going to do a little example just so you can see how this helps, how safe it is, how easy it is, and how fast it ends up working, okay? So today I'm going to have my assistant Vilma be a mock patient so you can sort of see how this goes. Vilma, come on over. I'm going to have you lay on your back. And then Calvin, I want you to go ahead and set her up while I'm talking, okay? I'll set up the mounts. So what you'll notice is that she lays down on her back in a comfortable position. One of the assistants will put the actual knee braces underneath the knee so that way we get your back in a comfortable position. And then you're strapped in with not just straps but sensors. What these things are doing is checking over 100 times a second to make sure that when the machine and the computer are expanding and pulling on your spine, that it's actually doing it in a safe and constant method. So don't expect to come in and feel yourself getting jerked really hard. It's going to be a slow, gradual pull so that way your body doesn't have a bad reaction to it. Secondly, with spinal decompression, it works faster than chiropractic and PT because when you get adjusted, that's just a quick snap. This allows you to open for the fluid inside the spine to actually seep back in to get into the discs, and it should be pretty comfortable. People are on here, they wear their headphones, they'll do whatever they need to do, but for the most part, you're just relaxing and being on the machine. Once we have this set up here, we make sure that the machine's not pulling and the straps aren't pulling on your body themselves or causing friction. You get what's called a kill switch, so that way you can turn it off if there's any worries or fears or anything. And then we're going to set it according to your x-rays or MRIs for you personally. So you'll see this table moves up and down depending on what we need to do and how much compression that you've got going on with your nerve. Another thing that sets this apart from the other tables is that it allows me to bring you to the left or to the right to have that decompression happen in that manner, so that way, depending on if your herniation or the discs or the hinges, called the facets, are messed up in that manner, and some people are even more severe, especially post-surgery or when they have a surgery that doesn't quite work, so that way it can tilt from one side to the other, so it can actually get the most accurate reading and the most accurate pull on you. Once we have you set up on this machine, you'll be smiling, just like Vilma here. We set it according to your weight, the amount of injury that you've got. There we go. And what you'll get to see is just a nice little comfortable pull. So for Miss Vilma, there we are. And there we are. They end up pushing the button so it can start the machine. For the first 60 seconds, we're not going to wait a whole 60 seconds, okay, today for yours, but it just weighs you out. It's tearing your weight, making sure that you're actually safe, that your body's reacting correctly. And again, if we have to stop for any reason, then we take you off the table and make sure everything's okay. What you want to look at is where the slides will be down here. And you'll start seeing just a gradual opening of the table as it pulls her, so that way it takes the pressure off her spine and her low back. And man, it can feel so good. And again, some of you are injured bad enough that you're going to need more than one session to help fix and deal with this problem. But we've had a lot of success. Most people who come in leave feeling better by the time they finish one of our programs. And we're not talking about a year, but just one of our programs. And now you can sort of see how decompression works, and you'll have more questions. Please bring those questions when you come in. Thank you. I'm Dr. Britton with West LA Neurokinesiology, DC.